So our primary patient populations are dogs and cats. We don't have an exotic specialist here at this time, so it's really going to be dogs and cats. Then occasionally we get an animal from the Denver Zoo, but it's going to be, I'd say 75% of our caseload is dog and about 25% cats at this point.
Well, one of the primary differences, of course, we're treating animals, so the anatomy is different. While like for humans, like if we're treating an adult human, like the sizes are about the same and anatomy is pretty similar. But for animals, we treat anywhere from between like a Chihuahua to a Great Dane, and with vastly different anatomies, and we have challenges associated with the small and the large. Another issue we have is, animals have fur. So for humans, we put marks on the skin usually to localize, but with fur it makes it challenging. And usually, as opposed to humans, like when we're treating animals, they're under anesthesia all the time. If it's a simulation and treatment on the same day, you have to work really fast, and so that is another one of the differences.
So I think our patient population is different from human medicine, where they're under anesthesia. So that's a big part, and a lot of, I think, coaching goes up front with clients about the anesthesia involvement in treatments. Because when I sit down and tell a client, I'm going to anesthetize your dog daily for 4 weeks, the eyes get big and we kind of go into panic mode. And so our typical patient, there's a lot of education that's happening up front in their initial consults, talking about the treatments. And once, we get into the actual treatment process, patients are dropped off in the morning. They all come in usually at a set time, depending on if they have an anesthesia port already placed or not. They get their IV catheters placed for their week of treatment or the day of treatment. And then we kind of set our lineup dependent on organizing with surgery and chemotherapy, sometimes even just my schedule for new starts. And then those patients are brought down to the linear accelerator where they're anesthetized in the vault. All their anesthesia monitoring equipment goes on. That actually takes up the bulk of the time. So humans, when you only have to worry about your beam on time, we have our patients coming in under anesthesia, all the monitoring equipment, and then we also will generally do a cone beam CT for positioning for all of our patients. And then most treatments are either going to be a 7-field arrangement or rapid arc type of treatment. Sometimes we'll do 3D conformal. And then those patients are under anesthesia for about 15-20 minutes of treatment. And then they wake up pretty quickly because our drugs that we're using are fast acting. And so most patients 30-45 minutes after treatment are munching on their brunch, and 1 to 2 hours after treatment are ready to go home.
So medical physics is like we sort of oversee the quality of treatment and safety of the treatment. So that includes like chart checks, checking every plan, being involved in the treatment plans that we do, doing quality assurance tests on the plans. But at the same time, we make sure the machine is running within established specs. So we do daily QAs, monthly QA, annual QA. On top of that, we also are sort of the problem solvers in the department, where if something is just not standard, it's something that you don't see quite often and questions come up, then like we jump in and we try to help out.
Man, I would die without medical physics. I think it's something that early on in our residency and our training, you were just kind of thrown into this world of physics, and it scares you very much because physics just inherently is scary to most people. But medical physics is our mainstay in our safety. It helps us, in terms of making sure that we're treating patients appropriately. It's our double check system. I mean, Imran and I are bouncing things off of each other constantly. Where he's like, hey, did you mean to do this? Or, what were your goals? Or I'm telling him in advance before he checks the plan, I know this is gonna look weird to you. This is why, this is what I'm doing. And I think you can't safely and appropriately do radiation therapy in veterinary medicine without medical physics support.
So I am currently the co-chair of the AAPM work group for veterinary and radiation oncology. And I'm also working with Dr. Kubicek in the VRTOG, which is a veterinary and radiation therapy oncology group. And we're designing a study to treat small lung lesions in cats and dogs, so like stereotactic radiation therapy treatment. hopefully we'll have a study that's geared towards animals as opposed to taking human data.
And so we rely on all the AAPM guidelines in medicine for our dosing constraints. And so we, right or wrong, are using human data to derive our radiation protocols for veterinary medicine. And so we're now trying to kind of flip it over and have our own veterinary branch of AAPM where we're actually focusing on our patients with dogs and cats and what are their true dose tolerances, what are the appropriate physic guidelines and support for us. So hopefully in the next 5 years we're going to have our own AAPM TG something.
Well, from personal experience, even though we're working with animals here, like we absolutely give it everything we have in terms of quality, safety, and the quality of treatment that we're delivering. So, if you send your animal here, you're in good hands. We have great people working here.
I think the biggest kind of myth busting that we do is it is similar to human medicine, but it is not the same. Our patients can't consent to this treatment. They can't agree with what they may not go through, whether it's chemotherapy or radiation. And so we focus very heavily on quality, where human medicine may be more on quantity, because again, they can make that call. And so I spend a lot of my time counseling that, yes, it is daily treatment. Yes, we do get side effects, but we're not treating to the same high doses. We're not treating for 6 to 8 weeks like humans. We're doing more hypofractionated protocols. And so we're balancing that quality of life. And so our goal is that we're coming in for treatment, we're doing a very safe treatment, and then our patients are going home, in between their doses and are maintaining a good quality of life. And so if they want to go for their WALKs, they can. They are eating, they're drinking, and if we're not meeting those goals because of radiation or from the anesthesia, then we don't treat. And knock on wood, that's happened never, where we can't get a patient comfortable with nervous coming into the hospital or, tolerating their anesthesia. There's a lot of different options that we can do. We have dogs who are really scared to come in, and some of them are just time and routine, because dogs are such routine-oriented creatures, and cats to a lesser extent. But dogs, where after a few days of coming in, they know Melissa who takes care of them. They know Rose who meets them in the morning. They know Deb who's doing their treatment. So they know their people and they know their routine. So most dogs jump right into it, without any worries. For the ones who don't, we have, anti-anxiety medications that you use for thunderstorms and fireworks to take that edge off. And for patients who are very fearful, we even have, instances where, they come at a very certain time, we sedate them in the room, we bring them back, we treat them here, and we bring them right back to recover with their owners.
I think one of the main things is people have misconceptions about radiation, that when you get radiation, you're radioactive. And but that's not the case with what we do. Like with the linear accelerator we have behind me, radiation is like a light switch. You turn on the radiation, you treat, and you're done. But in terms of treatment itself, like with radiation treatment, you can avoid surgeries in a lot of cases. So, not that kind of like scar recovery time as we would see if you actually had like a surgery done. So yeah, I think radiation in a lot of cases can be more beneficial than surgery. It really is a happy place because everybody, we work with animals here and everybody's just really nice, sweet, and I don't know, it's just something about working with animals just makes you a little more bubbly during the day.